Have you ever wondered how much training was required to become a surgeon in the medieval times and how they performed operations? As a general practitioner or family physician, I know that it takes around 10 to 15 years after qualifying as a doctor to become a surgeon in the UK. Back in the medieval times though, you would probably find yourself being operated on by a barber or someone you would expect a haircut from nowadays. In this video, we're going to explore the key aspects of surgery in medieval times. If you enjoy learning about how medicine was practiced differently through the ages, then please follow my channel, Doctor of the Ages. So, barber surgeons were surprisingly the main practitioners of surgery in the medieval period. They were barbers by trade who expanded their skills to include basic surgical procedures. So they would be able to do a lot of different tasks, from cutting hair and shaving to bloodletting, tooth extraction, and performing different surgeries. Their training was usually practical and they learned through apprenticeships. They would generally care for the poor and general population, whereas university-trained physicians would treat more wealthier patients. Tools used in the medieval era were particularly rudimentary compared to the modern instruments we use now. They were usually made from basic materials like metal, bone, and wood. Surgeons would use scalpels to make incisions, scissors to cut tissue or sutures, and forceps to hold or extract objects. Similar tools are still used today for some surgical procedures, but they also used a bone saw, which was a large tooth saw used for cutting through bones. Although we do use bone saws nowadays, they are a lot more advanced. We have electrical oscillating saws and flexible wire saws too. Trepanning instruments, including drills and gouges, were used in the medieval era. We do still have cranial drills, but they again are more advanced and usually are electric. Cauterizing iron was used to stop bleeding by burning tissue. Nowadays we use electrocauterization, which is a much safer and more precise way of controlling bleeding during surgery. So let's look at what kind of surgeries were performed in this era. Often people with serious infections, gangrene or sepsis would end up with amputations and losing limbs in order to save their lives. There wasn't really any other effective way of treating these conditions back then. These days we would treat infections with either oral or IV antibiotics to avoid sepsis, and people with vascular or circulation issues would be treated early with bypass surgery to avoid getting to the stage of gangrene. We do still amputate in some cases, but this was nowhere near as much as it was done in the medieval era. Trepanation was another common surgical method used, involving drilling a hole into the skull to treat head injuries, epilepsy, or even, surprisingly, mental illnesses. This risky procedure was done a lot more than we would do in the modern day, and we certainly would not use this to treat patients with mental health conditions. Fractures and dislocations were treated by immobilizing the broken limbs with splints or bandages. In many cases, these were actually effectively treated, especially when bones were properly set and immobilized. We do use different kinds of splints and casts to treat broken limbs today, but I would imagine it would be difficult to treat complex fractures, which we would now treat surgically using screws and pins. Bladder stone removal was another procedure performed at this time. It was a dangerous operation involving removal of a stone via an incision in the abdominal region. There were high rates of infection post-procedure, which probably led to poor long-term outcomes. Nowadays, bladder stones are removed using keyhole techniques, thereby reducing the risk of infection and complications. In the medieval era, surgical procedures were extremely painful and patients would have to endure them while being awake. Alcohol, herbs like opium, and hypnosis or incantations were used to try and manage the pain and sedate the patient. And I'm not sure many of us these days would be happy to undergo surgery with these methods of sedation and pain relief. Medieval surgery carried a high risk of infection, as the surgeons did not have an understanding of germs or the importance of a sterile environment. Surgical tools were also used often without cleaning, and as you can imagine, many patients died after surgery due to complications like infection or sepsis. So surgery has evolved in a lot of different aspects, including training required to become a surgeon, knowledge of the importance of sterile environments, surgical tool development, and the development of anaesthetizing methods. If you enjoyed this video and want to learn more about how medicine has evolved through the ages, then please follow my channel, Doctor of the Ages.